Good day, everyone. So we are about to discuss the part three of the key specialty areas of nursing informatics. So let's have a recap of our topics that was discussed in the previous uh, discussions or meetings. So it was discussed all about the nursing informatics model. So we have discussed also about the nurses in the Association of Nursing and Knowledge. We have discussed also the nursing informatics model in relation of the healthcare systems, the nursing areas, the concept of nursing informatics in the data being processed to information and the information transformed into knowledge. We have discussed also the components of the biomedical informatics and the methods and techniques and theories accordingly that are identified with bioinformatics as focus on cellular and molecular, clinical informatics, which is focused on individual, public health informatics, focus on populations, and consumer health informatics that are focused on health information, which is under the consumer health informatics. It was mentioned about e-health and m-health. The e-health is all about the health tools and services, and the m-health is all about the mobile health devices. So we have discussed about the biomedical informatics. We have discussed also all about the clinical informatics in its component of clinical care, information technology, health system. And in the clinical informatics, the focus is individual. So that's why most of the documentation, storage of data, protection of data, access of data, and information about the client's records are in place individually, which mentioned that the clinical informatics identifies as it the background on how to consider organizational skills and informatics knowledge, and it also identifies the role of nurses in the clinical informatics, wherein uh, it considers the records management on needs assessment, system selection, marketing, education, and implementation. It was discussed also all about the second, which is consumer health informatics. And we have differentiated the professional health information system and consumer health informatics application. So as shown in the slide, that the professional health information system are more on the records pertaining to the client and the organization, which may involve the professional expertise of the medical team, the nursing services, and other departments as well. So it included here the electronic health record, the clinical report forms, we have the integrated care pathways, and we have the clinical decision support system. While in the consumer health informatics application, this considered the access of the patients when it comes to personal health records, monitoring system, and personal health mobile applications. So both professional health information system and consumer health information informatics applications are used for feedback system. So the professional health informatic information system entails the healthcare process modeling, because this could be organizational to individual, and the consumer health informatics is the patient work framework. So it was emphasized that in the consumer health informatics, since it considers the health education, health information dissemination on how the patients or the client will be satisfied accordingly on the continuity of care. So it emphasized on health promotion, disease prevention, self-management, and patient-centered care, wherein we have emphasized also that aiding the client for self-management of health and illness, wherein the client can just access some of the basic information through the access of the information wherein the client may attend to, which, for example, first aid information, information about medication schedules, information about prevention. So these are the coverage of the consumer health informatics, which we emphasize three areas. We have telemedicine, telehealth, and telemonitoring. So in the telemedicine, the services can be done on a remote mode. So for example, the doctor is communicating through a video conference when it comes to the teleconsultation. While on the telehealth, this promotes more on an interactive educational materials and self-management system, which the client may have the independence to and may have the possible access rights to access some of the basic information which once they inquire or what once they address queries, they could be responded accordingly through the available interactive educational materials, which may promote also self-management system. While on the telemonitoring, this delivers patients' data to clinicians, which is, for example, if the client may have repeat diagnostic examinations and the results uh, uh, will be accessed and will be delivered accordingly to the specialists, to the physicians, and to the ones involved in the health team. So that is what we call telemonitoring. So that's the basic. Those are the basic difference between telemedicine, telehealth, and telemonitoring. We have identified also some of the basic examples on the consumer health informatics and its application. So we have health education website, web health forum, patient portal, and the fitness trackers application. So it was mentioned that in the health education website, this could access the basic information on the health, okay, health and wellness. On the Web Health Forum, this could be a platform that may have interactive discussion, either small group discussion or it could be organizational in nature so that information can be disseminated accordingly through this media. The patient portal could be individualized and may have access rights of the specific physicians, which may consider the individualized records of the client and the access of the patient. Okay, the access of the patient on what services can be availed accordingly, utilizing the information technology. The fitness tracker application, this may help. This may be helpful to for monitoring purposes, wherein the client can use the application to identify the weight, the vital signs, and this may have the access rights of the specific specialist for purposes of monitoring. So it could be blood sugar monitoring, wherein the patient can just enter the data and we useful as relevant information for the physician. So let us now proceed with the succeeding key specialty areas. So we have the educational informatics. In the educational informatics, there are three areas that are being used. We have it could be for learning and teaching, information science, information and communications technology. When we talk about the learning and the teaching, this educational informatics could be useful whenever there are some situations that may happen and may not need and may not possibly implement face-to-face classes. So that's why we have the flexible learning system, which identifies on online, offline, or the blended learning as a combination. So uh, and soon may include the face-to-face learning. So the integration of the educational informatics to learning and teaching is on how the students and the teachers, the professors will use the information science, okay, will use the information science to facilitate delivery of instruction. Just like in our institution, we are utilizing the Moodle platform so that to organize the delivery of instruction and this platform may have features that may meet the needs of the teachers the students, as well as the organization or the higher education institution. The information system is part of the educational informatics. Simply, this is how to process uh, information that will be more relevant and useful and meaningful as well. So just like, for example, in the learning and teaching, there are modes of delivery of instruction. The information science is it answered the how it will be delivered accordingly, using the platform on how it will process information, it will store information, how it will access the information, and how it will protect the information. So pertaining to the e-content, okay, of the learning platform, the virtual learning platform that are being used by the educational institution. While the connection of educational informatics in the information and communication technology is on how the information can be now delivered using the platform. So this is now a combination of how the learning and teaching could be possibly uh, could take place, and use of the information science on the storage, protection, access, and security of the data and information. And the information and communication technologies is the use of the various platforms that will significantly meet the expectations of the students and the teachers or faculty to deliver instructions. So in the educational informatics, it emphasizes the education, focus on education, develop, select, implement, and evaluate learning resources for consumers or health professionals. However, in the educational informatics, this may not just be this may not just only consider the setup of the higher education institution. Educational informatics can be also be applicable in a hospital. Just like, for example, for continuing professional education, for staff development program, for consumer, okay, for consumer health education as well, okay, if it follows through, because this is different from consumer health informatics. The consumer health informatics is the information are in place, the consumer or the stakeholders can access the information. While in the educational informatics, if it is modular, or it may require a step-by-step procedure for you or for the consumer to learn specifically the expected skill or knowledge. So as in the educational informatics, this could be very useful when it comes to continuing professional education. And on the number four, aside from the educational informatics, we have the public health informatics. So in the public health informatics, this is very significant on a community practice setting, okay, and implementation. So nowadays, in our public health emergency, it's very important to do the reporting, the contact tracing, the number of vaccinators, the number of the vaccines, the number of recipients and beneficiaries of vaccines. So this could support, the data could support the use of the information technology or the public health informatics, so that it will balance and it will be useful to plan, organize, direct, and evaluate a specific program implementation. So just like, for example, we have the vaccination program. So the vaccination program will start with conceptualization. So what are the logistics? What are the manpower that will be needed? When it comes to the design, how they will gather the data, okay, what specific mechanism or flow will be useful, uh and target efficiency as well, so that it could monitor the specific clustered group as per the IATF guidelines. So once the design is in place on how the program will be implemented, the development will now involve specific uh, fielding of the manpower needed, the specific guidelines that will be needed, the logistics that must be requested and in place prior to the implementation of the vaccination program. And when we consider implementation, the implementation is the wherein you're putting plan into action. Those that you have conceptualized, designed as the flow of the program, program flow and set up in the development wherein it identifies the specific manpower, logistics, and the mechanism. In the implementation, it's the uh, actual implementation or the actual setup wherein all that had been conceptualized will be in place. Now, the next other than the implementation is the evaluation. When we talk about the evaluation, you go back to the conceptualization, the design and development. If all of the set objectives had been met successfully. So the maintenance now is the sustainability. Okay, if the program had a good evaluation when it comes to the implementation, how it could be sustained in the succeeding planning or in the succeeding implementation of the vaccination program. Other example other examples of the process from conceptualization, design, development, implementation, evaluation, maintenance are the typical programs that are being offered in the community or through the public health. Just like for health information system, disease reporting. Okay, for disease reporting, just like for example nowadays, how to report the COVID-19 cases, and positive starts with the positive, those that have been tested and those that have results of negative. It may also identify specifically the disease reporting on those that are symptomatics and asymptomatics. And those that have been symptomatics, how they can be clustered accordingly with mild, moderate, and severe cases. So those are disease reporting. And we all know that the Department of Health is doing the 4 p.m. updates in the social media. So that's why there is a process wherein the design that the data report will have a cutoff out of 12 noon. And as of 12 noon, this data and information will be cascaded to the Department of Health. And the Department of Health will process all the necessary analytics, use of statistics so that to facilitate the percentage of recoveries for the national level, active cases, and those that are mortality or death. So other than the disease reporting, the scope of the public health informatics is also outbreak management. Okay, if the data are coming in, okay, if the data are registered accordingly, it is very easy for the city health offices, the Department of Health, and other concerned agencies. If the number itself that had been admitted in the healthcare facilities are sufficient to say that if it is already outbreak, epidemic, and the pandemic is global in nature, while the epidemic is considered as either national, regional, or local. So the facilitation of the data and the information that had been accessed and generated accordingly to analyze may be useful for outbreak management, and so that it may attend immediately as an urgent concern to facilitate plans and measures for prevention of spread and for those curative for those who may have symptoms. Cancer registries are also an example wherein it involves in the public health informatics because uh, the cancer may need special treatment, and they are the ones who are at risk of the immunosuppression since they are also taking medication and at the same time their condition may affect obviously the immune system. So it may identify For example, in the cancer registries, the type of cancer, male and female, the age, those who are receiving treatments, and those who are doing the follow-up consultation. Okay. Next, how about the health information system? In the health information system on the risk factor surveillance. Okay. If we talk about the risk factor surveillance, this is similar to the contact tracing. Okay. When someone has been identified as positive, then it may need to do contact tracing, okay, to those who have been exposed to the person who are positive for a risk factor surveillance. If we talk about surveillance, okay, surveillance is meaning monitoring. And it could be a risk factor to consider once you are exposed because the close contact would be considered as the one who may uh, afflict the COVID-19 virus, but seemingly they could be considered as the one being prioritized for testing for the close contact. Other than for the risk factor surveillance, is it may also identify if there are individuals who have been identified with the variant. So the close contact will have uh, a rapid test, which is a genetic rapid test, so that to identify if the same variant uh, have been identified to spread to specific groups or communities. Okay, how about the newborn screening? The newborn screening is a procedure that being done to newborns, obviously, so that to monitor any uh, congenital problems or anomalies that may significantly affect the systemic function of the newborn, and this may identify also the future uh, neurological state of the newborn. So the question is, for those who have been born, for example, for this month, how many newborns have been screened for the newborn screening? How many newborns are not? Because this may have the implication when it comes to the monitoring and may have an implication possibly on the preventive measures. So these are the health information systems. This is reporting, necessary for the data gathering, outbreak management, so that to declare a problem with the outbreak, epidemic, pandemic, cancer registries, those who have those data that may identify specific types of cancer and specifically may consider the aspects on those who those who are attending treatments and those who are not attending treatment. For the risk factor surveillance, the risk factor surveillance are the ones that are being identified specifically on the aspect that may be preventive and promotive in nature, so that to identify the risk factors to prevent the spread. Next, we have the newborn screening, which are very essential for the newborn to specifically identify the neurological status and the health status of the newborn. Now, the public health informatics are very obviously considered as a measure to use the information technology in the community level, which may help the health workers and the policymakers to facilitate specifically identified issues and may translate it into the policy. And one of the concerns specifically or concept that are specifically identified in the public health informatics is epidemiology. In the epidemiology, it may identify specifically morbidity rate. Also, you've heard that morbidity rate, wherein, for example, those who are sick on specific disease can be identified easily and can be accessed easily. Another is mortality rate, so the number of deaths. Okay. Uh, we have also we have identified the mortality rate, the morbidity rate. Uh, these are typical examples that are being addressed in the community and may need the data accordingly. So with this situation, the public health informatics could be in the United States. We have the Centers for Disease Control and Prevention, which may centralize the data being needed to facilitate analysis. Here in the Philippines, we may have DOST, okay, the PCHRD. We may have also the Department of Health, and the Center for Disease Control and Prevention could be, or the CDC, could be global and the World Health Organization. So the public health informatics are very significant when it comes to the efficient uh, and resourceful gathering of data. Now, the public health informatics are similar with these concepts, which are implemented in the global setting, just like public health information network. From the term itself, network, it's focused on the shared information. Shared information, for example, here in the country, in the Philippines, shared information from municipality or locality to provincial, provincial to region, from region to the national level, to the agency that is responsible for the gathering of the data, which is the, for example, Department of Health. While the information exchange service is for public health providers at the regional level. Okay, so let us now differentiate the two. The public health information network are shared information, okay, shared information from the the state. The state are referring here in the Philippines on the state, meaning the the a wider scale. For example, we have Luzon, Visayas, and the Mindanao, and connected the network to the local public health organizations, which are the local and the local government units. While while the information exchange service is for public health providers at the regional level. So this may involve the exchange of information with specific experts, specialists at the regional level. Okay, regional level, for example, from region 1 to region 12. Okay, and that is different from the national level. Okay, so public health information network are shared information among the municipalities, the local government units, while the information exchange service is among the providers, the specialists at the regional level. Now, we say the biosurveillance programs is all about sharing of informations that are connected with health threats, outbreaks, adverse drug effects. So that is biosurveillance programs. A typical example of this is that of, for example, in our situation of the public health emergency, sharing of information on health threats. For example, uh, one community had been locked down, and because the basis is the number of COVID-19 positive in the community. Will that be a health threat to other communities? That could be possibly a health threat. So that's why preventive, it is isolated from the term bubble. The bubble, the concept of the bubble itself is to confine all the individuals not to have contact with other individuals from other communities. So that's why they use the concept of the lockdown. So that is what you call the biosurveillance, the sharing of information about health threats such as disease outbreaks and adverse drug effects. Uh, and a typical example of the biosurveillance program is the vaccines, okay, vaccination program. Once every individual has received the vaccines, they will monitor any adverse events. Okay, that is part of the biosurveillance program. How about vital statistics? The vital statistics could be collection, distribution, and security. Okay, this is data. Okay, that's why if we say vital statistics, how many deaths, or what are the mortality rate of that community? What is the mortality rate of COVID-19 of that region? That is vital statistics. How about those individuals who have been positive with comorbidity? comorbidity, pre-existing illnesses such as diabetes, hypertension. That is the collection and the distribution. The act of performing the collection distribution that is related to health in 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 a in a collective population group, that is vital statistics. Okay. So in the public health informatics, it may involve specifically the epidemiology, which I have reiterated. In the epidemiological tools for outbreak, it may involve the reporting, which I have mentioned. Epidemiological tools are tools. It could be mobile application, okay, which the client can just enter basic information and may process the information going to the city health office. So these are the shared services that we are talking about here, are the strategies, the architecture. The architecture that we're talking about is how the information has been processed. The standards could be the security. The requirement could be possibly on the data privacy. The capacity on how the information can be accessed easily. On monitoring, if the information are being updated every now and then. Evaluation, if the information that had been gathered has followed the quality control. So these are the information system that supports public health practice. So electronic medical record, these are informations of the client that are registered in the computers of the city health offices and what they call this city health offices and the community health centers. The electronic lab information management and reporting system, this is now happening. That's why when the client or community people uh, had undergone the swab test, the electronic lab information may process the information accordingly. But that is based from the shared services as guidelines. The electronic integrated disease surveillance information. So we had mentioned about the biosurveillance. The electronic integrated disease surveillance is on the specific disease being identified in the certain community. And the mobile-based system surveillance is used for public health emergencies. And the mobile-based system could be accessed as an application in the mobile phones. So you see that epidemiology, the electronic medical record, electronic lab information, mobile-based system, and electronic integrated disease surveillance information system are are very important even nowadays in the public health information. That's why every 4 p.m. the Department of Health has all of this basic information with the specific analysis that are presented in the social media because it follows through the process of the public health informatics. While in number 5, we have the research in nursing informatics. The research in nursing informatics obviously is using systematic methods. So in the systematic method that we're talking about is we gather data. Once we gather data, we collect the data, we gather the data, we analyze the data, and then eventually may translate into conclusion or recommendation. An informatics nurse uh, may take part when it comes to the utilization of the findings of researches, which is very important as part of the recommendation. So this is a typical example of the framework as well when it comes to how the healthcare system will be very important in research in informatics. So let's integrate here the vaccination. Okay, how the Food and Drug Administration will facilitate the issuance of the emergency utilization permit. Okay, the EUA. How for the vaccines. Okay, and how they will issue the compassion permit for those drugs that are being used but not yet commercially registered in FDA. If you will notice, if you will notice in here in the healthcare system, we have the pragmatic clinical trials. So we have studied about the clinical trials in pharmacology. We have clinical trial 1, 2, 3, and 4. Nowadays, we are in the administration of the vaccines to the population. We are on the level of the clinical trial 3. So because those vaccines are just only given with the emergency use authority, it is not yet for the commercial registration. The safety surveillance is referring to the those that have been vaccinated if there are adverse events. The randomized clinical trials are those that are uh, trials that have been done to individuals who receive the vaccines. Observational studies are those that can be done through the observations of the professional medical experts or nurses. Quasi-experimental studies, this may specifically identify a control group and the experimental group, those who have not received vaccines, those who may receive the vaccines. So the clinical research informatics is useful on how to process all of these informations to methods, tools, and standards. And eventually the results of this may help the research centers to make a further analysis of the results and this on and how the results could be considered as research priorities that may benefit the population of health. In the triage of the research in informatics, healthcare system could lead to the benefits of the research center because it may improve, okay, it may improve the health promotion and prevention. Healthcare systems can be directly involved the population of health because of the results that are processed and analyzed have been translated into policies. So those are the basic informations that are very necessary when it comes to research in nursing informatics. So I think that was the last slide. So this ends up our part 3 on the key result areas. Thank you very much and God bless.